Good afternoon, everybody. If you haven't already met, my name's Steph, and I run My Surgery app. This is a quick update for you all on the major app update we're due to release. We're very grateful for the feedback we've had from the practices who are already using the app since November 2020, and for the patients who have given us the feedback for the app here. I'm about to share the screen with you now to show you what the app update entails. So if you take a look at the screen to my left, I think it is, you'll see here Grange Road Surgery, part of Grange Road GP cluster. So this obviously is the fictional seed surgery and cluster. So now you'll see that there's a number of new icons, and the app's home screen has been updated quite a bit with a few new buttons. Now, don't forget that the app can be all of these buttons can be enabled or disabled in your portal. The first one here is arrive yourself a face-to-face appointment. So we had a few requests from GPs to build this really during COVID. But a lot of patients gave us feedback as well that they didn't like to use the arrival systems in reception areas that some of you guys may be using, if it's JX or NewMed or Engage Health. These companies are now developing remote check-in, so patients can check in with just a URL, which you can put either on your website, but we've also duplicated this in the app for surgeries. So if you do want to offer online face-to-face appointments to be patients check into the app, you can enable that now in the app. The next is I need help with a medical issue. So for those surgeries who are using Ask My GP, eConsult, Accurx, Engage Health, or Clinic as your online triage provider, then this is the button that you would enable, and we put a URL link then behind here. So it says, I need help with a medical issue. Send us an online query about a new or an ongoing symptom. The patient simply clicks here, and it goes through then to your eConsult or Accurx page. But if you're a surgery who's not using any of those services, don't worry. Then we just won't enable that for that button in your practice app. The next button is order repeat prescriptions, and we'll go into more of these in a lot more detail in other videos. But this will give you just a quick overview of the new buttons on the app's home screen. So if a patient clicks here, they can log in straight away if they have an account with My Health Online. They can just click there, and it'll take them through to either your EMIS or Vision My Health Online portal. If they don't have an account, then they can register for the online services here as they have been able to, but we've put the registration and login icons on one page, so they can go through the normal registration system then that they would. They fill out the form and submit 2 forms of ID to you, and that comes through to you then in a digital format. Patients don't have to come into surgery anymore to register for My Health Online. This is the new button. So this is called admin queries. So patients can request admin queries, and we've done some research and some work with practices in Wales. There's a lot of research that backs this up from NHS England and NHS Digital to show that about 39% of all calls coming into a GP surgery are admin related. The rest are of a clinical nature. So the admin related are continuation papers for fit note or sick note, or a doctor's letter, or discuss a test result, or an update on a referral query. So instead of a patient having to phone you now to make those requests, they can do it through the app. If you've got eConsult or Accurx, then it'll still link to that portal for you. So for example, if a patient clicks here, and you're with eConsult, then they could click on doctor's letter, and it'll take them then to your eConsult referral platform. But for surgeries who are not using eConsult or Ask My GP, then you still have this functionality. So when a patient does click this button for I have an admin query, they can be taken to here. So let's for example say that they're requesting a sick note. Then the app will ask them, have you been sick for 7 days or less? And if they say or more, if they say no, they can download the sick note there. And all of these come through. You can designate in your portal an email address, inquiries at, or admin queries at your W number email. But this will really help you, hopefully, to reduce the amount of phone calls coming in. I mean, if they click here and click on test result, they can select the test result they've had from the drop-down box, fill in the form, and they can submit that, and that comes through in an email format for you. And then you've got a full audit trail then of all the admin requests coming through. We've got a training video that you can show your receptionists to help them promote this to patients, because even if you could reduce your phone calls into surgery by 25%, by a quarter less, that would make a huge difference for you guys in practice on being able to manage your phone lines day to day, and also your access targets. So that's a new button that we've built, and that's available to all practices, whether you use online triage or not. The patients can now submit that admin query through the app. Then there's a symptom checker, which it's already available in the app. Book an appointment. Of course, you can disable or enable that in the app. I want help for a condition. This is our health resources page. And again, patients can search by scrolling, or they can search by keyword here. So again, if I typed in smoking, it would bring up all the stop smoking resources that we build for you, and it helps. It links to Help Me Quit then. But that's the button for the clinical queries that patients have. But that all links into NHS information. There's not anything that's not NHS based. We are a syndicate partner with NHS Digital, so all the information is being ported in via API from their website. So if I was to type in here, for example, vaccination, then it'll bring up a vaccination schedule. We link to Fit for Travel vaccinations, but a patient can look then to see, when the schedules are. And because and if they want to find out more information about that vaccination, then it links directly to the NHS resource for that. So we don't link in the app to anything that's not NHS Digital based, and that will hopefully avoid patients having to use Dr. Google from now on. The next button then is community and voluntary services. So as clusters or as practices, you are working a lot closer now with third sector, social prescribers, link workers. This is a directory, much the same as this button is a directory of clinical services. This is a directory of non-clinical services, and it could be things like walking groups or befriending groups, or counselling services, mental health services, anything that's not clinically related can be put in here. So, for example, the default here now is the DEWIS directory, and the patient click on here, they can see videos then all about the DEWIS service. They can find services in the area. They can find service for adult services or children, young people. They can find events near them. They can follow them on social media. But that button really is for, and you can allocate login details as long as the cluster does authorize it to third sector partners, so that they can populate this. So much the same as DEWIS is a directory of services. Now this can be a directory of voluntary services or anything social prescribing that's localized to you for your cluster only. It's not a national database, so you can really narrow it down really, and then all of your third sector partners can put that information in there for you. Everything else in the app is the same. There's also a health hub now where patients can manage their medicines and their chronic conditions such as asthma and COPD. They can get reminders when to take medication, when to reorder medication, when their appointments are due, and the app will send push notifications to them to say, right, your asthma appointment annual review is due, and it'll send them notification 14 days before that then to remind them to phone the surgery. We go into that in a lot more detail in other videos. So this is an update for you now on the app's major update. Based on user feedback, both from practice managers and patients. If you'd like to see any more videos on how all of these features work individually, then please do visit our website. They're all there for you. So any questions, please do give us a ring. My name's Steph, or visit our website. Thank you.